of you who don't know me, my name is Dr. Rachel Kieran, and I'm currently the president of GPA. So it's the busiest year of my life, and I'm loving it. I'm very grateful for our wonderful leadership, our staff, everybody who has contributed, and particularly to our membership. It's nice to see so many of you here today, and we will be answering some questions. Thank you to those of you who sent questions ahead of time. I know that Anita and Janet have thought about those already. And then also, I know that they'll make time for questions after they've presented some information. So I'm just going to very quickly introduce the Georgia Psychological Association's Director of Professional Affairs, Dr. Anita Brown. Anita, you want to give us a wave? In the screen? Oh, I think I might be highlighted right now. So we'll get Anita on in a second. And also Janet Orwig from ASPPB is joining us today. And Anita and Janet have done, are largely the architects of PSYPACT's success in Georgia. So we owe them tons of thanks for that. They spent a very busy year helping usher that through in Georgia. And just in time, right? Because we had PSYPACT about to go live just when all of this happened. So I know I'm one of the people that's benefited from that. I have people who in the pandemic had to leave for other states. So this has been useful. So Anita and Janet are going to talk a little bit about the status of PSYPACT and interjurisdictional practice, and we are super grateful to them for making time today. And Anita and Janet, I'm going to turn it over to you.
Okay, thank you very much. And Janet I'm going to give you just a brief overview of our agenda. We're going to leave plenty of time for discussion because this is a town hall forum and we don't want to bore you with the details. We'd like for you to ask about the details and we can try to answer them. And forewarned is forearmed, there will not be answers to everything that we can provide today, but I'm committed thoroughly to trying to address any questions you have with whatever resources I have. So with that being said, my brief introduction and Rachel's brief introduction is over. We're going to start with Janet giving us a good overview so you know what the future holds for PSYPACT and where they are right now. Janet, give us your appropriate title too once you start. And then Rachel will come back and sort of give us an overview of the tools that she's been instrumental in manufacturing to help people get through the application process. I'm going to do a very brief overview of where telepsychology is and sort of the Georgia view of telepsychology. And then we'll have the rest of the time for questions and presumably some good answers for you. So Janet, would you like to go ahead and take over?
Okay. Thank you for allowing us this time with you guys today. I am going to try to share my screen. I have just a few slides. And I'm probably not even going to share all of them. I do think they have put the slideshow into the resources for this presentation so that you can go back and look at them. Let's see if this is going to allow me to do this. We will try. So I'm hoping everybody can see slides.
Yes.
So anyway, so I'm just going to touch a little bit and talk about the current status of PSYPACT, where we are right now. We do currently have 15 states that have enacted the legislation. We actually were very lucky to add 3 during 2020, which is kind of was unexpected with the way all the legislative bodies closed down around February and March. So we were able to get Pennsylvania in May. We were able to get Virginia in April, and North Carolina came in July. Both North Carolina and Virginia have a later effective date, which means they will not actually be able to participate fully in PSYPACT until those effective dates have passed. So Virginia will become fully effective January 1st of 2021 and North Carolina March 1st of 2021. One of the things I will highlight is that because these 3 states had enacted the legislation, they are able to apply for the E.Passport. Any psychologists that are licensed in those states, if you know anyone and they are considering that their home state, they can apply for the E.Passport. They just will not be issued their authorization to practice interjurisdictional telepsychology until that state becomes active or effective. So we still are very lucky to have a few states that have some active legislation. The District of Columbia, we've had a couple of sessions with the deputy mayor as well as the city council. They are a little structured differently, of course, and so we're still hoping to see something happen maybe before the end of the year, but they are, as with a lot of states, struggling with budgets and trying to figure out kind of how their next year is going to look. Kentucky just recently pre-filed for the 2021 session, so that is a brand new bill. They did have a bill last year, but like I said, because of the way the legislative sessions worked, they ended up being closed before they were able to act on that bill. Michigan has a current bill, Minnesota does, New Jersey does, which is one that recently got introduced as well. Ohio has an active bill. It has actually passed the Senate and is waiting to be heard by the House. And from what I understand, and there are quite a few other compact bills that are there as well for the other professions, we all are kind of keeping our fingers crossed and keeping a close watch on Ohio. We think that once the House opens back up, they probably will start hearing our bills. Rhode Island, we have been introduced in Rhode Island 4 years in a row. So, but the difference in this year versus any of the other years, we are actually part of the governor's budget bill along with all the other compacts. So we are kind of keeping our fingers crossed on this one as well, because we think that we will see some action based on what kind of bill that we are in. What we are looking at for 2021 is, like I said, we had several states that had active legislation when everything shut down. Alabama, my understanding is that the bill sponsor that sponsored it last year will be introducing again in 2021. So we are hopeful. It was actually a very well received bill. So we are hoping that it will be able to go through. We are hoping to see the same thing happen in Florida. We were introduced in Florida last year. We're hoping to see that again this year. Indiana has confirmed that they will be reintroducing again this year as well. And we are working again with Tennessee, and hopefully we'll see a bill introduced there as well. We also have been in contact with actually an individual psychologist in Kansas who has kind of taken the PSYPACT as his goal and has been working with the organizations and bodies there. So we're hoping to see something maybe happen in Kansas as well in 2021. So just kind of a brief overview. I think everybody probably already knows how this works, but the states have to enact PSYPACT, as we were just talking about. The commission was established actually when Georgia became the 7th state to enact. That was how many we had to have. So you guys are get super kudos for being our 7th state. And then what happens is that the psychologists that want to practice under PSYPACT, they have 2 components. They can either do telepsychology or they can do temporary in-person face-to-face. And so they have to go through the proper requirements to get to either one of those, depending on which one they want to do. If they want to practice telepsychology, they have to apply to the commission for the authority to practice interjurisdictional telepsychology, or the APIT. And the one thing that I do want to point out, because that was one of the questions that came up, was about the continuing education requirement. In order to get your APIT, you have to apply for and receive the E.Passport, which is issued by ASPPB. It is the only certificate that ASPPB issues that actually does have a continuing education requirement. It does require 3 hours of continuing education at the time of the renewal. So if you've gotten your E.Passport this year, it will not be due until next year. But it has to be involved with something to do with telepsychology. And so academic courses are something from an approved sponsor for continuing education. And what it has to be, we've kind of tied it to what was in the ASPPB, the APA Trust telepsychology guidelines. So any of these criteria of these 8, if it can focus on any of those, and if there's any, if you're concerned or questioning whether or not a course that you're wanting to take might not meet the requirement, you can solicit something or send something to me, and I will run it by the mobility committee just to make sure. But if it falls within these categories, we are not expecting there to be any issues, as well as it does not have to be an in-person continuing education. It can be a virtual continuing education. So the same thing with the temporary authorization to practice. If you want to do that, you have to apply through the commission, and as part of that, get the interjurisdictional practice certificate, which does not have a continuing education component. The fees for the authority to practice, what you pay the commission is $40, and there is no renewal fee. You will pay ASPPB a $400 application fee with a renewal fee of $100. We are very, very lucky and very fortunate and very appreciative of a HRSA funding grant that ASPPB received to help with the CARES Act. And that has allowed us to waive the E.Passport application fee through the end of December. So currently, the only thing that would be being paid when you apply would be the $40 that goes to the commission. If you're wanting to do the temporary in-person face-to-face practice, you would do the $40 for that, for the TAP application to the commission, and a $200 application fee to ASPPB, and then a renewal fee of $50. Another thing to point out about the IPC, or their interjurisdictional practice certificate, is that it used to be a freestanding certificate, and actually Georgia was one of the states that recognized the certificate. And if you had that, you could go into one of the 6 states that recognized it at that time and practice temporarily for up to 30 days. Because it was tied to PSYPACT, we thought it was going to be very confusing to still have it as a freestanding certificate for some states and be under PSYPACT for others. So as of June 30th, it was retired as a freestanding certificate. Anyone that had the IPC at that time does not have to reapply. It is, you will just be able to reactivate that and use that to go forward with your TAP application if you choose to do that. And if you are currently in a state that does not recognize or hasn't enacted PSYPACT, once your state does that, I'm being very optimistic that once your state enacts PSYPACT, you would be able to just activate that. So we tried to take into account people that had already held an IPC and not penalize them because we were putting that program in sunset. So have we reached our destination yet? Yes. Applications for the APIT and the TAP are now being accepted. And what I kind of wanted to touch a little bit, and I really want to say, kind of give a little bit of numbers before I go into the application process. So far today, I did check this morning, we are a little bit over 1,600 applications. We have issued 645 APITs amongst all of the jurisdictions, and 54 TAPs. And for Georgia, we have issued 89 APITs and 9 TAPs. So I tried to make sure I had the numbers for all of that. And then the other part I'd like to thank very much, I'd like to thank Rachel and the GPA for all of their resources that they have provided regarding the application process. That has really helped. We were taken by surprise, I guess, by the, or we thought we were prepared, I guess is the better thing, for the amount of applications we were going to be receiving and in all the questions that were going to be coming. So the materials that have been provided by the Georgia Psych Association has been absolutely amazing, and I cannot thank you guys enough for helping cut some of our questions down. And there's just a couple of things. I think we're going to talk a little bit about those resources later, so I'm not going to go into much detail here, but just a couple of things I wanted to highlight. To get started, go to the PSYPACT website. It's just the easiest, and click down there. You'll go through those processes, and then the landing page. This seems to cause some confusion. When you get to the landing page, you'll see that it says My Credential Bank, and people start to go down there. And part of the way the ASPPB's credentialing program is structured, the Credentials Bank is the base. So everything kind of assumes that that's where you're going to want to go, and that's not true. For this case, you're going to want to go over to the right rail and hit practicing telepsychology under PSYPACT or practicing temporarily under PSYPACT. You don't need to fill out all the materials that you would if you were trying to set up your Credentials Bank record. And then the other thing I wanted to point out was the examination record. We do require for the E.Passport that you provide information regarding your EPPP score, but it does not require you to fill in the candidate ID number. Anybody that took the exam from 1984 on is in the computer, and we'll be able to find you. If it's before that, we have to go back to paper records, but if we need any additional information, we will contact you to help us find that information. And then the submit review, we'll see not started. And until, when you look at the going all the way down that page, there's a part down there where it says official transcripts. And once that says documents have been uploaded by ASPPB, you will be able to then submit your record. But even though you may have completed all of your sections, we still have to get the transcripts into us and be able to have those uploaded before you will be able to go in and submit your application. And that is kind of just my brief overview. I know we're going to kind of have more questions and all of that. So that is all I have right now.
Okay. Is Rachel back? I can't see. If not, there was one question in the chat room about will the video be available? And yes, it is available, and the link is there. Our Director of Operations, Sylvia, just has listed it there. So that question has been answered. I think that
the video,
Bill?
Anita, about today, the video of today's thing.
So the video that I linked is the video that Dr. Rachel Kieran created for filling out the application. We are recording this town hall and we'll make that available on the website after the town hall's over.
Okay. Question answered? Yes, yes, okay. Bill Doverspike asked a question about the 6-hour trust workshop usually covers telepsychology, so would it count? I guess my question that is posed to you, Janet, but it also entails how much of the trust workshop is actually focused on telepsychology itself. So that might be a hard breakdown to estimate would be my immediate response. But Janet, do you have a response to that question about the 6-hour APA trust workshop?
We have not seen that one, so I am not sure, but I can take that forward and have it reviewed so that, and maybe get you that information back so that y'all can post that on the website as to whether or not that is a covered CE. I would imagine if it contains enough telepsychology that it would be, because I know we have been doing presentations with the trust regarding telepsychology and that kind of thing. So I know we have that relationship with them, but I am just not that familiar with that workshop.
And Bill, I'm presuming you're talking about the trust workshop that typically is held at GPA annual meetings the day before the annual meeting. I'm presuming that's the one you're referring to specifically, but maybe you'll weigh in at that. We will be opening up to more general questions in just a few minutes, barring Rachel. And Rachel, if you're here, I can't see the whole viewing. If you're here, go ahead and jump in and talk. But I wanted to address just a few issues. First of all, I really do applaud, well, I thank Janet for being my partner in this adventure. Right from the very beginning, we could not have done it with the support of ASPPB, even in terms of introducing the idea to membership. I thank you for the numbers in Georgia, and I applaud everybody who not only stepped up to the plate and built out their practice using telepsychology with the advent of the COVID crisis, but even just as it relates to PSYPACT, you are one step ahead of the curve. It is the wave of the future. And I think that you're just building a practice that will help to advance psychology. The fact that we're approaching 50% of the states in the United States as PSYPACT or PSYPACT friendly kinds of states lets you know how your practice can be built. And we will continue to explore with members ways to make your practice unique so that you can fill some of the gaps in service because you have a uniquely positioned approach to practice or population with whom you practice that will make you indispensable to other states. I think it's also important to recognize those states that surround us. Georgia likes to be the first in the legislature to pass a bill. And so that we have North Carolina, South Carolina was on the verge. I know Kentucky, Tennessee, Alabama, Florida are the states that Georgia kind of looks to. And so the fact that we're in there and we're beginning to garner neighbors in other states near us that want to do PSYPACT is also a plus. I would say that the board has been, the psychology board in Georgia has been fully supportive, as of course in the long term has been APA. One of the things that flared up about a year after we passed PSYPACT was this whole authorization of the state board to request that a background check be done. The state board jumped right on it. The bill was passed. The state board embraced it, and at this point, I'm not sure when all new licensure applicants will be required to do a background check. And I'm also not sure. We have a little bit of a grace period for existing licensees in Georgia to do the background check vis-a-vis the PSYPACT application. But the board, as I said, has been fully supportive. Now, recognize that that will add a small fee. I think, I don't know how much it costs to have a background check in Georgia, but it will add a small fee to the PSYPACT fees as well, a one-time, as well as to the state license application and process. We've also had the support of state agencies, Department of Community Health, the state legislature, for continuing telehealth practice and authorization to do that in a more flexible way past COVID. DCH and the state have said that they will adhere to federal guidelines about when these relaxed standards for practicing telepsychology or telehealth will go back to what they were. And we're hopeful with the advocacy of APA and all of us that some of these things will remain unchanged, will stay as they currently are, especially in light of PSYPACT after the national health emergency has been declared no longer an emergency, and goodness knows when that's going to be. We're not having in Georgia some of the same problems that other states, as I know from my network with the other DPAs, with getting reimbursement for telepsychology. Even though there have been some things that have happened in Georgia, and I encourage people who are having any kind of problem with getting parity in telehealth or telepsychology reimbursement, that you bring that to the attention of the Georgia Psych Association Insurance and Managed Care Committee. If you're having any problems with getting what you deem appropriate reimbursement for your services, please bring that to our attention. Advocate on your own behalf, clearly, to get that payment that is that you feel that you're due. But let us know, because there's force in numbers and we need to know when those problems occur. I will be attending the commission virtually meetings, those meetings, the next one's in November, mid-November, and hearing what I can and learning what I can, and recognize that the current chair of the PSYPACT Commission is a strong Georgia Psych Association member and former member of the board. So at this point, barring Rachel's return and her willingness to address any questions you have about—
I'm here, Anita. I'm sorry.
That's
my
all
computer
right.
decided to have a moment.
No worries, but if you'll go ahead and address whatever thoughts or questions you have, and then, well, any thoughts that you have about both your video and your tutorial, and then
Sure.
We're going to open it up to questions. We do have a few, maybe just 2 or 3 questions that were sent to us beforehand, but at 12:26 we have a good hour to cover a lot of stuff.
Awesome. Hannah, are you still on? Maybe not.
Yes, I'm here.
Okay, Hannah, would you be willing to share your screen and pull up the video and the handout? And I can chat as you're getting to that, but hopefully that way we can just show people where these are. So we got a lot of questions on the GPA listserv just about what information do I need to fill out? What information don't I need to fill out? Where is this located? All the kinds of things that all of us go through when we are filling out an application. And of course, for many of us, it's been a number of years since we've had to do applications, thank goodness. And so we thought it would be useful if we tried to answer those. And I have to give a lot of credit to the GPA Premium listserv, because some of this information came from folks sharing their experiences as they walked through this process. I was by no means the first GPA member to apply. And so people shared little nuggets of information about, you know, this was the person I talked to at ASPPB and they were really helpful and they said this and here's this information. And so what we did was we compiled all that information in two places. One is a 2-page handout, front and back, that really kind of walks through the steps, and there's also some screenshots in there that just tell you where to go, what things to answer, and also what things not to answer. Because if you go on PsyPro, and Janet, if I get any of this wrong at any point, please correct me, because it's very likely. But if you go on PsyPro, which is the application site for ASPPB, that includes all the credentialing stuff that you can also use for the EPPP and for licensure. And to get, if you're already licensed, to get set up for PSYPACT, you don't have to do all of that credentialing stuff. And several people, I think, discovered that the hard way. They were being very good and very completionist and making sure they filled out everything. And it was taking a really long time. Like myself, I could not remember the date that I got licensed or that I took the EPPP. It turns out that close enough is fine. Thank you, ASPPB, for being okay with averages. So we compiled that information. So there is a 2-page handout, and then also I videoed my screen while I was going through the process and then edited that video down. So there's about a 6-minute video of all the places that I clicked. And that's what Hannah has pulled up now. I'm not going to force everybody to watch it, but it's actually on GPA's YouTube channel, because that's where we've gotten in the world. GPA has a YouTube channel. So if you go on YouTube and you search, I think it's called GPA Staff is the YouTube channel, then you will find this. And we're also going to make sure that there are continuing links to this every couple of weeks in the newsletter, so you should be able to find this pretty consistently. But we really just wanted to create some tools, even just some confirmation for folks who maybe have gone through this process already, that they did in fact complete all the steps. The other thing that I reflected in there is just what I heard back and when I heard back, because you have to complete a step, wait for ASPPB to certify it, complete the next step, and so on. I don't know what other people are finding. For me, the whole process took less than 2 weeks, I think. Less than 3 weeks to get to the absolute end. So it's actually not as complicated as I think we were worried that it was, but it certainly helped to have some information. So if people need those or are having trouble finding them, certainly don't hesitate to reach out to any of us, but do look in the GPA newsletter. We're going to continue posting them in there for as long as possible. So.
Any questions for Rachel? Okay. And the chat does have links to pretty much everything that we've talked about. So let's go to questions. And there's one elephant in the room. And there's a couple of different iterations for it. But all of them pertain to practicing outside of the state. So let's, if you think about the permutations, the psychologist could be in the state and the patient could be out of the state. The psychologist and the client patient could be out of the state. What's another permutation? The psychologist could be out of the state and the patient could be in the state. So all of these have relevance to PSYPACT and relevance to the practice of psychology as a Georgia licensed psychologist. So 2 people have asked, and I'm sure others, please address confusion as to home state rigidity related to telepsychology. And so I'm going to frame this, Janet, you're up, but I'm going to frame this as a question under PSYPACT. So if I'm a PSYPACT enrollee and I have my APIT, please let me know what is my home state and what does that allow me to do or not to do. A couple of permutations to people in other PSYPACT states, to people who are not in PSYPACT states, to people in Georgia. Janet, I'm going to ask you to address that, if you will.
Okay. As it stands right now, if you are a Georgia psychologist and you are licensed in Georgia and you have listed Georgia as your home state, you have to be sitting in Georgia to practice telepsychology with anybody in the other compact states. That is the way it is stated right now. The commission will be reviewing that at its meeting in November due to the amount of questions that we've had. I still think there will be some kind of reliance on that. I think one of the questions that we got was somebody is licensed in Georgia and they're licensed in Connecticut, and Connecticut is not a PSYPACT state. And they wanted to know, could they practice under PSYPACT into Connecticut while they're sitting in Connecticut, but still be practicing under their Georgia home state license. That is the type of situation that the commission will be addressing, because you do have a license in that other state that you have that authority to be sitting in that state doing that. But right now, as it stands, until the commission has had a chance to look at this further, you have to be sitting in Georgia as your home state, providing services into any of the compact states while you sit here.
Thank you. Okay, so there may be questions from the audience, and I would ask that we stay focused on this particular question, although if you have other permutations, state it, but because there's a couple of other iterations of this we want to address. But let's address any questions that anyone has about the rigidity of home state is what you list on your PSYPACT application, although that is under consideration, and we'll know more about that after the commission decides. And Janet, you may also weigh in on how can people address their concerns about this to the commission? Where's the point of dialogue back and forth between the commission? Are they open to receiving information or feedback about this? But let's, go ahead.
Well, I was just going to say this too, that let's say, go back to my Connecticut example. You have a license in Connecticut, you have a license in Georgia. Connecticut becomes a PSYPACT state. While you're in Connecticut, you can set that as your home state. When you come back to Georgia, you can set that as your home state. So you would be, if you're licensed in 2 compact states, you can do that. But and then the other thing, the commission's meeting is November the 19th and the 20th. It is an open meeting. Information, once we have that set up, the Zoom information will be available on the PSYPACT website under the commission tab. And we strongly encourage people to attend. There will be a section open for public comment. So please feel free to join. The commission would welcome that.
Any questions from the audience about this particular issue? Okay, we have time, so there will be time. And you also then, thank you, Janet, addressed in part the question about Connecticut. And I think that was Mary Helen. Do you want to, are there any further iterations to that you would like to, or would you like to speak to that for a minute? I know you're on the call. So.
I think that you answered it. It was the question of, being licensed in both states. Unfortunately, I don't see Connecticut on the horizon for having introduced legislation or anything. So,
they did actually. It was an interesting bill. I kind of wish they could all be that way. It was pretty much one sentence that says we enact the compact. And as you have seen the legislation, it is about 40 pages and not one sentence. And I was like, it's too bad they can't all be that easy. And we've been working with them to make them understand they need the bigger version. And so we could see something in 2021. They are not against it. It's just we have been trying to explain the whole process.
Thank you. I appreciate you so much addressing this.
So the importance of being an advocate in your home state whatever that might be, and an advocate, a member of state-side associations generally, or specifically in the states where you live. Hamid asks, what has been the reason that the commission has adopted that position as of now? And I could not even speculate. Any thoughts, Janet? I suspect they didn't ever think that it would be an issue, but do you have any thoughts about why the commission adopted that position?
It is based on their understanding now how it was drafted to be. That is something, like I said, that we really, I think, because of all the questions we have gotten, realize it's now got to go back and be looked at. Is that how the language has tied our hands, and that's why we have to stay that way? Or is there some flexibility in the language, and is that the direction they want to go? But I think originally was based on the language the way it was, that was our interpretation about how it had to go forward. And it still may be that the language is that tight. It's just, we're going to now have a conversation about it. Where is that tying our hands? And is that the way we want it to go forward? But the commission has not, they have not had this, they haven't seen their agenda yet. So they don't know yet that they're going to be having this whole conversation about that. But we have alerted the chair that we are having these issues, and he is aware that this will be on the agenda for their November meeting.
I will say that someone was speaking. I will say that the commission, well, psychologists, we tend to, listen and be sort of flexible. Not everybody on the commission is a psychologist. And some of them really are stakeholders in their state government. So while we might expect that it's reasonable that, this be changed, you're dealing with folks who have boots on the ground, as we say, in those states, and they may have reasons in other states not to change this. Also, it's sort of an empirical question. Sometimes you don't know what the issues are going to be until you actually get up and running. And it's interesting that this and others like this have been some of the first ones. So, Hamid, I hope that answers your question. And Rachel, you had a question that I think we addressed, which is if someone is licensed in 2 PSYPACT states, can they have 2 home states? Janet just mentioned briefly that you could change your home state once you're back in the state that you want to practice from. So for instance, licensed in Georgia and Connecticut, when you're in Georgia, Georgia can be your home state. You can go through the process of changing it to Connecticut for whatever period of time you're in Connecticut, which seems a bit burdensome, but I think this is a question that will have to be addressed. And so Penny, you bring up a point that I think is a very interesting point. Penny asks, so it is currently more restricted to be part of PSYPACT if your home state is Georgia and you are at the beach in Alabama and want to see a Georgia resident via not being part of PSYPACT. This question sort of took Janet and I think everybody, well, a lot of us at the July PSYPACT CE up at Nelson Mullins' office by surprise. And so after a year of looking at it, after a year of digesting the state law and the policy and the telehealth policy, and I am no expert, I think what you'll find is that Georgia policy and law, and there's only one person on the board on here, but there are prior members of the board, is silent about whether or not you can practice into Georgia from your beach home in Aruba or Alabama or Florida or anywhere. Janet and I have had some talks about this, and there are 2 things that you probably need to be aware of. One is there are some states, I think Wisconsin was one of them, where if you are in Wisconsin and you are doing psychology but not licensed in psychologist, it does not matter where your patient is or where you're licensed. You will be in violation of Wisconsin law. No, they do not have jurisdiction over your Georgia license, but you are liable if you're in a state where they say that you cannot practice psychology while you're in that state, out of that state, even if you're licensed. So Janet's response, and speaking for her, has always been, yes, you're right, Penny, and everybody else who has this thought. However, you still need to be careful that the state you're in, and you're calling your patient back in Georgia, your client patient, has laws that you need to be aware of. And so you should always be aware of the laws in the state where you are. The other part of it is, where is your patient? If I'm in Alabama and my patient happens to be vacationing in North Carolina and is in a crisis, and I'm talking as a Georgia licensed psychologist to my patient that I typically see in Georgia from Alabama to North Carolina, am I in compliance? I'm not sure that Georgia law speaks clearly to this point. So once again, be aware that it feels very comfortable and very non-restrictive to be a Georgia psychologist, where the law doesn't clearly come down on where you have to be when you're practicing. But I think it still behooves you to be wise about that. And so those are two of the other iterations of this that, at least at the present time, PSYPACT has nothing to do with. And yes, PSYPACT may be more restrictive if all you want to see is Georgia clients.
But Georgia's not, I mean, PSYPACT isn't going to impact in this because you're a Georgia license seeing a Georgia patient. So that's right. Not part of participating in PSYPACT. It's only if you're a Georgia licensee and participating in PSYPACT and your patient is in Missouri, then that's when PSYPACT would be involved. So PSYPACT's not keeping you from seeing your Georgia patient from another location. That other location where you're sitting may be where your issue is. A lot of them, I did put out a message to the board admins asking them this question. If you have someone that is a psychologist that's sitting in your state, in vacationing in your state, and they're wanting to have services with their client that's back in their home state where they have license, how many of you would consider that practicing without a license in your state? And I would say, I have to preface it, we've changed our firewall, and so we've had a little bit of issues with our emails about the time I sent out my message asking for responses. So when I say a lot of responses came back with they would not consider that practicing without a license, I didn't get a huge amount of responses because of the issues we've had with our emails. So I think it is very, very important that if you're going to be vacationing or seeing somebody back under your license in Georgia, that you check with that licensing board. And I know one of the links that was provided is to a page on the ASPPB website that provides all the board contact information. So there's the phone numbers, their locations, their emails, along with links to their rules and regs and statutes that are all can be found on that page that might help with that process.
And if you look at the chat room, you'll see that Bill Doverspike and Rachel have responded with some interesting information. Dr. Doverspike says, as I learned this summer, North Carolina is also one of those states. And Rachel says, and I believe there are also states which specify under their licenses that you can only practice while you are physically in the state which you are licensed. I'm not clear that Georgia is clear about this. That's exactly what we know. Just be cautious and be careful. And then Anne Marie says it's ironic that the whole point is for mobility of service, and yet the professional is held hostage to home state. This is true. But at present, the profession of psychology has not felt the need for a universal license, as medicine has, as nursing has. I mean, there are a number of professions that feel like, you know, the license is the same across all jurisdictions, state level jurisdictions. Psychology has not been there, and I'm not sure when psychology will do that. We're entertaining questions from the floor. Otherwise, I'll go to the only other question that we received.
I'm curious to know, do you have any idea why Florida is not in this PSYPACT and what their resistance to that is? Because we have for instance, I have someone that I'm seeing, and he goes to Florida for 3 months in the winter and then comes back. Now, I contacted, and a good way to find out about each state, I contacted the Florida Psychological Association and spoke with their administration, and they were able to clarify that evidently in Florida, someone can practice up to 30 days of a year without being licensed. But I don't know why Florida is resisting. Do you, since so many people go to Florida?
So actually, Florida is there's actually a very good mechanism for you in Florida. They passed in 2019 a telehealth bill that allows you to register with, and I'll get the link and get that put on these resources as well, but it allows you to register to provide telehealth services into Florida without being licensed there. You just have to get an agent of record to basically have an address in Florida, and there's an application or registration process. So you can't physically go to Florida and see anybody, but you could see your patient via telemeans if you had this registration. And unfortunately, that bill is kind of what hurt us a little bit getting PSYPACT into Florida, because they felt like the PSYPACT bill conflicted with that bill that they had done in 2019. What we're trying to educate them going into 2021 is what that bill has done is allow psychologists to come into Florida, but it hasn't done anything about the Florida psychologists being able to see anybody outside of Florida. So we've got a little bit of education to do with the legislative bodies in Florida, but they were actually very open. We had very good bill sponsors. We had the Psych Association as well as the board in favor. They just got a little confused how we were going to impact that tele-registration law in 2019, but I will send the link and let them get this on the materials for that registration process. So I think that will help address your issues in Florida.
And I think that Rabia has put up some information about Florida on the website, and Mary Helen says it's very easy, exclamation point.
Anita,
Yes.
Dale.
Yes.
I just want to address that. I think that there gets to be a complication in our minds about interjurisdictional practice versus telepsychology. I mean, so there are, and during COVID, when COVID hit, many of the licensing boards across the state, across the nation, changed their telepsych requirements and who could practice. I mean, there were many states that just sort of lifted all kinds of restrictions. The Georgia board chose a different path through this boundary. But be sure that you recognize that telepsych is a part of PSYPACT, but PSYPACT really deals with the interjurisdictional practice. That you have to, that it's across the jurisdictions is what I'm trying to say, as opposed to how do you practice telepsych. And reading those individual state laws has become really quite a challenge now, because some states just threw all of their practice requirements sort of up in the air to allow maximum flexibility, and there's not, some of those states didn't even put time restrictions on them. And so there's going to have to be this reckoning that comes sometimes over the next few months when they're ready to pull back in. And I think it's very different now than it would have been if PSYPACT had been enacted without COVID occurring in the midst of that, is part of what I think has made things a little hard to sort through.
We have, ASPPB has added a page on their website, a COVID-19 page, and we have tried to keep up with what the boards are doing temporarily. You're right, we have Idaho, which is also the state that will make you be licensed there, but they never had any executive orders. They've never been remote. They function just normal. And then you've got some that have orders that have been extended that do not have a termination time on them. The executive orders, there's no registration, there's no notification. So we've tried to keep up with that. There's also a link on our page to the Council of State Governments, which has done a really good job of keeping each of the state emergency orders in the order in which they came. So when one has gotten renewed, they have added that to their list. So if you are questioning doing relationships in a state telemeans that are not part of PSYPACT and you want to do that, that's a really good resource to see what their orders are. I have been talking with all of the boards on an individual basis about this as well, and a lot of them have been trying to keep their websites up to date as to when those orders will expire so that people can be made aware. They also are saying that they're seeing some increase in licensure applications based on people going ahead and planning that they're going to continue these relationships and let's go ahead and get a license in this state so that I don't run into that issue later.
Good. So looking at the questions in the chat, Hamid says, can we provide the commission comments now, or do we need to wait till past November 19th? And I bet you Janet's going to say provide them now, but Janet,
I
do you
would
want to
take
weigh in?
provide them now, yes, and they can be part of their agenda materials. That would be very, very helpful because of the time constraints we have on the meeting itself, because it will be a virtual meeting. And I do have, as you know from looking at the map, a lot of West Coast commissioners. So we're trying to be considerate of the timing of when we start the meetings and how long they go, so that we're going to be a little tight in our time. So anything you can provide me ahead of time would be very much appreciated.
So one other question from Carrie Woodward, logistics. With PSYPACT, do you need to contact the psychological board of the state where the patient is before starting to meet with them virtually, assuming the state is a PSYPACT state? I would say the answer is no, and that's the whole point of PSYPACT, is that it circumvents what the temporary, what some of the very different kinds of interjurisdictional practice, the temporary authorization to practice, they were sort of all over the board prior to PSYPACT providing a more common standard. And that was actually one of the arguments that we use, that it really raises the standard of interjurisdictional practice. But am I right, Janet, in saying back to Carrie and others who have that question, there's nothing you really need to do in PSYPACT to PSYPACT state, except to make sure, well, there are some things you need to do, but you don't
Right.
have to notify the board. You clearly need to know the, is it standards of practice of the state that you're practicing into, Janet?
You do need to be familiar with the rules and the regs of the state they're practicing into, as well as their scope of practice, because you do have to practice under that. And no, you do not have to notify the licensing board. They have access to the PSYPACT directory. So that is how they're able to know who has the ability to come into their state. So that's how they're notified. So you do not, as an individual psychologist, have to do that.
So this question about standards of care, scope of practice, maybe I should say scope of practice, what resources is PSYPACT going to provide to their PAP?
So one of the things that we are working on will be as added to the PSYPACT website, and hopefully we will be getting with the commissioners in November to talk about this, is having them create a page for their state with links to where things are located, anything specific to their state that they feel that a practitioner coming in needs to know, so that you will have that as a state-by-state resource as you're looking at practicing into that state. That is one of the things that we will be providing. Right now, we're just doing applications, but we're going to get there.
Well, I have one question of the group. How helpful would it be to have an ongoing forum of PSYPACT credentialees across states, across, all states, key states, because there's a lot of information that gets shared just sort of word of mouth and through experience. So would you all have an interest in doing something like that on a regular basis, or setting up a listserv? Or listservs can be a bit burdensome to just plow through. But what interest would you have in creating a forum or a discussion group of other PSYPACtors? We need a name for you all, but any thoughts? How about a listserv? Okay, very helpful. Thanks, Bill. You're such a great supporter. Okay. Well, keep that in mind as we move forward. And Bill says also again, okay, Bill, that was privately. I'm just going to put it up there. Yes, scope of practice is defined by that state's laws rather than by PSYPACT. Correct. Okay. Thoughts, questions, floor is open. We're at 12:56. Hearing none. Let's see if I can. Janet, is there anything else, or Rachel, that you would want to say, or
I was going to
Gail?
joke that we've answered them all. We've solved all the problems.
Oh, right.
I'm encouraged and excited that the commission is going to be re-examining all of these things. I think there's a lot of people who maybe are feeling frustrated. I know it's not perfect. You know, we're continuing to grow and change, and I think that's exciting. It's exciting that we have states that are continuing to move forward and join. I know a lot of people said, well, why not Florida? It's like, well, Florida's getting there. We just have some kinks to work out first. So yeah, I'm trying to think of other questions people had asked. Yeah, absolutely, Susan.
I did get approved for with APIT, and I simply got an email to that effect. And I wondered if there was, in communicating this, say, to a patient in Texas, I would have liked to have sent her some document or certificate that confirmed that. And all I believe I had was an email. And I wondered am I right that there's no official certificate to confirm my receipt of the APIT?
That is correct at this time. That is another item that is on the agenda for the commission to talk about, is whether or not they want official certificates or just a more official letter that lists when you got this, and that kind of information. So they will be discussing that in November as well. We have a good many house cleaning items that will be on their agenda, and that is kind of one of those. And as well as the other. And I'd kind of like to go back a little bit to the home state issue. As I said earlier, the language is kind of how we've been looking at it. The one component that I think will be something that will be primary in the discussion is how discipline would be handled if we threw in a state that you're sitting in that is not a compact state. So that is probably how the discussion will go forward as we're evaluating you're licensed in Connecticut, you're licensed in Georgia, and that kind of thing. So the language plus because we have laid out that disciplinary process so tight, how we would address that will be probably considered as well. The other part that they will be talking about housekeeping is also how you list this, how you can put it on your website, how you can put it on business cards, that kind of thing. That's also part of the housekeeping that the commission will be looking at their November meeting.
So I see that we're really focused on the application process. That seems to have evened out and really gone pretty smoothly. Gail asked something, and then the question was, how do you plan to market if you don't have some sort of credential behind your name that says I'm a PSYPACT psychologist? And if you don't, how do you plan to market that you can practice interjurisdictionally? And Gail says, raises an insurance question. Do you need to notify your malpractice carrier to this new area of practice? And I know Janet's going to say, look, insurance issues are not the scope of what we do with the PSYPACT Commission or with ASPPB. However, you can believe there are going to be a whole lot of insurance questions raised by this cross-state practice of psychology. And one more quick thing I'll throw out there before I ask you to address it: parity is a big issue anyway. So parity between what you get reimbursed for telepsychology, for mental health, versus what your physician's getting reimbursed for mental health. There's a lot of insurance gray areas in this that I'm sure are going to loom. So how are you going to market this? And what about insurance? What questions or responses do people have? How have you handled it?
I'm curious if anybody on the call happens to have renewed their insurance recently. Were they asked any questions about seeing folks virtually or anything like that? Rabia, did you?
I didn't renew, but I did ask Trust, and they said that we're allowed to do telepsychology anywhere in the U.S.
Okay.
As long as we're allowed to do so. So under PSYPACT, that would be covered.
And I did renew, and there was not anything specific about it in terms of.
Interesting. Yeah. I think Hamid had something to add too.
Sorry, hi. I renewed with the American Professional and there wasn't a question. In the past, when I have contacted them, their perspective was anything that is under the umbrella of what psychologists do, the American Professional covers.
Nice.
So that's a nice, straightforward question and a very simple answer. However, to me, the devil's in the details. And is there something unique about, for instance, the code of ethics as it relates to telepsychology, and using your judgment? You know, what is the standard of care to use your judgment? How do you handle a client or a patient in crisis who's suicidal? What kinds of informed consent do you give? So it's very nice to be able to hear, yes, anything you do as a psychologist is covered, but I think we all know that there's a different approach to practice using telemeans than there is to, you know, having a person come into your office and sit across your desk from you. So that, I think, it's ripe for discussion, even before you get too far down that road. And that's where CE will come in, I think, as well. Any thoughts, anybody? So, not to be a downer, but it's just that you're better to go forward knowing what the possible pitfalls are. Susan, I see you're on the line, and I appreciate you being here. You're sort of one of our go-to people for telepsychology. So, Susan Litton.
One of the issues that I think we need to really pay attention to, this goes back to what various states require, is that the length of time, the requirements for things like child abuse and the process for those kinds of things are very different across different states. So that is something that I think we need to be very aware of.
At a meeting that I was at in January or March, just before COVID shut everything down, one of the psychologists raised that issue about duty to inform, particularly if the person that you're treating is underage. And some states will say, you know, the age is different and you have to inform the parents. And so, you know, what happens if you're in a state where the parents don't have to be informed, or the patient moves to a state where the parents don't have to be informed, but in your state, you know, and one of the most striking things that was said was, you know, you don't have to accept everybody as a patient. If you don't feel comfortable practicing under the scope of the state that you're practicing into as it relates to something in particular, informing the parent of a minor versus not informing the parent, then you don't have to practice in that setting. You don't want to abandon your client or terminate prematurely, but, you know, just be mindful that you have a choice here about doing what's comfortable depending upon the scope of where you are and what your standard of practice is versus, you know, where you're practicing into. So, and it's going to help to have a forum of people who are doing the same thing you're doing. Your community of fellow caregivers who are doing what you're doing is going to be absolutely crucial. So I can't believe we don't have more questions. Janet, is there anything you'd like to, you're on. Okay.
We do have one. I saw that about having a list of members on the PSYPACT listserv. So as I mentioned, we do have the PSYPACT directory that is for use for the licensing boards. That is, and I know it sounds like a broken record, that is on the agenda for the commission to discuss having a public directory, and that you would be able to opt in if you are a holder and would like to have your name put into the directory. So that is something they will be addressing. We did, like I said, we created the SYPACT directory for the jurisdictions, but we are seeing a need to be able to let the public know who can participate. So that is one of the things that we are looking at, and kind of getting some cost on how much that would cost to create that as well.
I'd like to throw a question to the group, and it kind of has to do with marketing. What brings you to SYPACT, to becoming a SYPACT participant? And Hamid, I'm going to call you out because I remember from very early on when I was chair of LLC that one of the things you talked about was language diversity and being able to practice across state lines where people needed your linguistic diversity. Others have talked about particular populations that they treat or particular approaches and techniques. So can anybody share, would anyone be willing to share, what is it that represents a specific draw to you for interjurisdictional practice?
I mean, I think you just addressed it for me, certainly, Anita, that I work with populations that often have difficulty finding a provider with my specialty, which is in sexual, gender, and relational diversity, particularly in rural areas, especially when you talk about areas where it might be, everybody knows everybody else. There's a lot of gossip in small towns, all of those things that we hear about when we talk about rural psychology. And so they often find they have to go to urban centers to find somebody with a specialty and or somebody they don't have a dual relationship with. So to be able to reach out and do, sometimes it's a one-time assessment, other times it's ongoing therapy, for those people to have access to someone with whom they, A, don't have a dual relationship, and B, who has the necessary specialty. That is the thing that's really important for me.
Related to that issue, as you mentioned, Anita, for me it has been the fact that I speak Farsi, and many patients in other states often call me, and I tell them, I have had to tell them in the past that I cannot see them because they're in another state. There are not that many Farsi speaking psychologists, so that has been the issue. Another factor that I think is interesting is that in some communities of immigrants, and I imagine other communities, people actually rather see a psychologist that's not local to them because of what somebody else said about, I think what Rachel, you said about other communities, rural communities, because they don't want to be recognized. I've had people who have come to my office and stayed in the bathroom until they knew that my door was open for their appointment because they didn't want to be in the waiting room. So with telepsychology, that obviously is not an issue. So.
I used to joke with Jackson Rainier, who was his specialty is rural psychology. I used to joke that I was a rural psychologist, and he said, "Rachel, you work in Atlanta." And I said, "Yeah, but I work with a community within a community, and it's like working in a small town." And so, yeah, I think that would be a great benefit to have your psychologist be so far away that they couldn't possibly know the people you go to church with or that you hang out with or your parents. Yeah.
A related question for me would be, how have you dealt with converting whatever it is that you do as your approach to treatment in a virtual kind of way? If you're doing very behavioral treatment, for instance, or if you're doing, and I can't even begin to think about, I know psych testing has been something that people have really said, oh, wow, how do I convert this to, a more virtual platform? And we are very creative folks, and we do a lot of things that, you just have to think outside of the box. Can anyone relate to something that you've had to do, particularly in this COVID era, that might have been a little bit uncomfortable, but you feel like you've worked out the kinks that you'd be willing to share? Okay.
Well, I'm a little unclear about the question at hand. I know I jumped in here a little bit late. Are you asking, to what extent being able to do cross-state kinds of services in the field of assessment, why that is something some of us would want to see how we could achieve that? Is that what you're asking?
Well, that would be an important issue to address. Mine had to do more with the techniques that you've had to adapt to do assessment strictly virtually, for instance, in your instance, but feel free to let us know what you're thinking.
Well, yeah, I mean, I primarily practice neuropsychology, so of course I end up doing largely assessments. And our practice before COVID hit, when collectively for all of our services, about 1,200 visits a month, so it's fairly high volume. And we've done a lot of research looking at a lot of listservs and looking at instruments that have been validated and published to be able to be adaptable for, telehealth kinds of stuff. So we have developed batteries at various ages now that we've been able to implement telehealth as an option for those patients that, for one reason or the other, need to have it done by telehealth. There's still some that prefer to arrange to come into the clinic. But going forward, my guess is this is going to be here to stay. And there's certainly a strong advantage that we've not had in previous times to offer services to people in the rural area to do telehealth. When you get into rural parts of Georgia, there aren't a lot of neuropsychologists around. There's not even a lot of psychologists around, period. And so, and those that are there, oftentimes they're not necessarily specialists in assessment. They may be good at therapy and what have you. So, we're looking to obviously make that platform available, but in the same context, particularly to PSYPACT and cross-state issues. I mean, I had a problem already once this week. I specialize in integrating neuroimaging techniques with psychological assessment, and there was a family that was referred to me out of Florida, and my staff had set up for me to do an intake evaluation with them. I thought they were traveling from Florida into Georgia, and even though we're doing it by telehealth in Georgia, it's still in Georgia, so it's not a problem. Little did I realize, or as soon as I got onto the conversation, they were calling me from Florida. And I said, stop, this is not, I can't do this, this is, I'm servicing you from Florida and I'm in Georgia, and this is a violation of, I'm not licensed in Florida. Now there may be provisions once I check with the Board of Examiners in Florida where I can get granted sort of temporary, or we can do something like that. I know we've had some other PSYPACT meetings that talked about certain states allow you to have certain periods of time where you can do that kind of thing for limited periods of time. But I don't know what the state of affairs is now for Florida, and I really don't know what it is now. I mean, a lot of things have been laxed or made more lax for being able to offer services, but I don't know where that stands. And that's obviously one of the interests, because I do get a lot of people from out of state, but invariably, of course, I ask them to come into state to do the workups or even to do the consultations. And PSYPACT, of course, would make that easier, more convenient for certain people in certain locations.
So David, because you joined us a little bit late, you'll note that we did have this discussion, and if you'll look in the chat up to, I think Rabia gave us a website for Florida, and there was a good discussion about, I can't remember, there's a registry, Janet, you were speaking for Florida specifically. That you
Unfortunately, when you rejoin or when you join late, you can't see all of the previous chat.
Wow.
So Rabia,
Okay.
if you want to repost that, because that's a really useful resource.
Thank you. And I apologize. I was just finishing up another
okay.
meeting, so I couldn't get out of it sooner.
But I think you'll find that informative. Rabia just posted it. And
okay.
So there maybe see the value of these discussions.
Right. Thank you. Okay.
Anita, I mean, since I'm not practicing, I'm not going through all this process, but we found ourselves in the Georgia legislature finding an ally or in the legislative process that we didn't anticipate. And that legislator's issue was service delivery to military families who were separated geographically in varying configurations. But he was a retired military. He was still very strongly connected to that community. And he had been approached by military psychologists or members of the military to support PSYPACT because of the opportunities for families to receive services in a way that they can't unless they're physically in the same location. So I don't know that anybody on this call has that as an interest, but it clearly is a need. And I know Dave Belton felt especially strongly about that population.
And I understand from Janet that has been a push by the military in other states that's gotten PSYPACT some good flow as well, right, Janet?
Some of our practitioners who are in areas of Georgia where there's a military base nearby, you may have not been getting involved in services to many of the folks either directly or indirectly involved in those families because of limitations. And this may free you up to offer services that you would otherwise not have been able to legally and ethically provide in a way that was comfortable for you.
Mm-hmm. Good.
I think that the other thing that, you know, as we worked through the PSYPACT process, we're talking about people in Georgia that have expertise that people from outside of the state may want to be able to access. But that also means that there may be some people trying to practice in Georgia that have not practiced before through the PSYPACT. And I think that we need, I mean, I'm not talking about running around, we're not going to be the PSYPACT police, but if you're concerned that people have not gone through the right process or they're not recognizing Georgia law or they're whatever, is understanding how that gets addressed, because, you know, the rules are changing, the rules governing PSYPACT are significant, but the licensing board rules are really clear too. And it's still incumbent upon us as psychologists to make sure that our colleagues are operating within the appropriate legal and ethical standards that we all operate under. So recognizing that, and I know Linda Campbell at every board meeting was always concerned about the potential threat to Georgia practitioners with PSYPACT. It wasn't just opening up opportunities for our members to provide services, but she was very protective of our psychologists and how they might be impacted by service providers being able to offer services here. So there's going to be a lot of going back and forth, and there's going to be big adjustments. And I see several years of Janet Orwig being on everybody's speed dial or sending her emails or checking that website and doing all of that, because I think we're all learning that as we go along, this is complicated. It's requiring boards to think differently. It's requiring the commission to anticipate or deal with problems that had not been anticipated during the legislative process. I mean, I think there's still lots of ground to be covered here. So I don't think everybody's going to get all the answers that they want today, but I think that it's an indication that we're all trying to work toward those.
Thank you. That's correct. So any final thoughts or comments? I think that it's important to continue, as has been stated, this ability to dialogue. It's good to know that the bumps in the road about the application process have obviously smoothed out. We have how many in Georgia on the APIT? 89, you said?
That's what I heard Janet say, and 9 in the tab right.
Right.
Because I bet Bill and I are taking note of that, so the licensing board will know that tomorrow. I've tried to keep them updated as I've gotten numbers.
So, Jan, do you have any last thoughts that you'd like to share?
I don't think, guys, thank you very much for letting me be here and answer any questions. And the slides that they posted, my email is at the back end of the slides, the contact. Please do not hesitate to contact me. One thing I would like to just kind of add is that we, as I said earlier, have been just trying to get through applications and trying to get through them as quick as possible. And I appreciate the kind words about how fast some of those have gone. That makes my heart feel good. But we have also added a couple of temp people to help us process so that we can continue to get them through as quick as possible, because we know as the time is right now, people need them. So we are working as fast. And if for some reason you have an application that you think is taking too long, please do not hesitate to reach out to me and we'll do a check to see if we can figure out what its problem is, where it got bogged down. So again, thank you very much.
Well, thank you. And I know you're on your way to New Hampshire virtually to do this as well. So thank you.
Yeah, I want to thank Anita and Janet both so much for making the time. I know that they took some time to plan for this, to curate some questions and to really think about those challenging questions that people threw at them. So thank you both so much for your time today. We really appreciate it.
Thank you.
Yes.
Thank all.
Wonderful.
Thank
Everybody,
you.
be well. We're going to have another town hall in October, and there'll be details posted about that. I think we're going to talk about membership communication and how we can best serve the members. So come along and talk with us. We love getting to see everybody's faces, and we really want to keep embracing the spirit of transparency and letting folks know what the association is doing. So we really appreciate you all.
And feel free to send me questions or post them on the premium listserv if you are a member, and we'll try to get answers if you want to know something. Thank you.
Awesome.
Appreciate everybody. Stay well.
Thank you.
Great
Bye-bye.
day, everybody.
Bye-bye.
Bye.